So I'm gonna talk about physical aspects of laser therapy in medicine. So what is laser therapy? Laser therapy are is a medical treatment that uses focused light, unlike most light sources. Light from a laser, which stands from a light amplification by stimulated emission of radiation, which is it's what it stands for. Laser is tuned to specific wavelengths. This allows it to be focused into powerful beams, so laser light is so intense that it can be used in shaped diamonds or cut steel. So, in medicine, laser therapy, it's called LLLT, which is low level laser therapy. And so in medicine, lasers allow surgeons to work at high levels of precision by focusing on a small area, damaging less of the surrounding tissue. If you have laser therapy, you may experience less pain, swelling, and scarring than with traditional surgery. So it's a easier way to relieve pain and do some other medical procedures. Laser therapy is used for different cases as treating pain, improve vision, in cosmetics, treatment for different kinds of cancer, shrink or destroy tumors, polyps, for treatment of hair loss, etc. But how does laser therapy works? So, laser therapy will behave according to the basic laws of light, in which light travels in a straight line at a constant velocity in space. So therefore, laser therapy, in simple yet realistic terms, can be considered a form of light amplifier. It provides enhancement of particular properties of light energy. And therefore, laser lights, and therefore this laser light can be transmitted, refracted, and absorbed. It can be placed within the electromagnetic spectrum according to its wavelength and its frequency, and which will vary according to the particular generator under the consideration. Laser therapy has different physical aspects, which can be divided in its monochromicity or monochromic, its coherence and its polarization. So the monochromicity of a laser is a device that emits a monochromic light through a process of optical amplification based on the stimulated emission of photons. So laser therapy uses just wavelengths. For the coherence, describes all properties. So what is coherence? Coherence describes all properties of the correlation between physical quantities of a single wave or between several waves or wave packets. So in this case, if we have a laser light which is coherent, it will be the waves here, the waves here will be coherent with themselves, and therefore they won't go between themselves, and they won't go over the other waves like these ones. So it will be directed to a straight point, and it will be stronger. The laser light will be stronger. And then polarization. Polarization is a properly applying to transverse waves that specifies the geometric orientation of the oscillation. So in this way, the linear polarization of the fields oscillate in a single direction. In circular elliptical polarizations, the field rotates at a constant rate in plane as the wave travels. So this one is a linear polarization, so it goes to a single direction. And this means remains some doubts whether they are essential for their use in the therapeutic application. However, monochromicity is probably the most important factor, as many of the therapeutic effects have been noted in various trials with light which is non-coherent. Additionally, it is thought that the polarization is soon lost within the tissues, and it may therefore be less important than was thought at first. So, monochromicity is the most important aspect here for laser therapy, and especially the Korean one. So this is more or less different types of devices for laser therapy. So most LLLT apparatus generates a light in the red visible and the infrared bands of the spectrum, of the electromagnetic spectrum. The typical wavelengths of the laser therapy, they range from 600 to 1000 nanometers. The mean power of these devices is generally low. It goes from 1 to 100 milliwatts. and though the peak power may be much higher than this, sometimes it depends on the treatment, depends on what the doctor is treating, depends. The treatment device may be a single emitter, a single emitter like this one, may be a cluster of several emitters, though it is common for most emitters in a cluster to be non-laser type devices. The beamform single probes is usually narrowed at the source. A cluster probe will usually incorporate both higher and lower power emitters of a different wavelength. So the LLT, when applied to the body tissues, delivers energy at a level sufficient to disturb local electrons' orbits and result in the generation of heat, initiate chemical exchange, disrupt molecular bonds, and produce free radicals. These are considered to be primary mechanisms by which the LLT, the laser therapy, the low frequency laser therapy, achieves its psychological and therefore therapeutic effects, and the primary target is effectively the cell membrane. So the laser therapy targets especially to the cell membrane. Although much of the applied laser light is absorbed in the superficial tissues, it's proposed that deeper or more distant effects can be achieved, probably as a secondary consequence via some chemical mediator or second messenger systems, though there is limited evidence to fully support this contention. However, as many other forms of energy delivered to the patient under the umbrella of electrotherapy, the primary effects are divided into thermal and non-thermal. LLT is generally considered to be a non-thermal energy application, though one must be careful to appreciate that delivery and absorption of any energy to the body will result in the development of heat to some extent. Non-thermal in this context really relates to the non-accumulative nature of the thermal energy. Photobioactivation is a commonly used phrase in connection with the LLT, meaning the stimulation of various biological events using light energy but without significant temperature changes. So this means more or less that the laser therapy it's a non-thermical way of treating, non-thermical therapy. Despite feeling some sort of heat, it's non-thermical, and laser therapy is therefore very important in different kinds of treatment nowadays. And here, and as we can see here from this picture, these patients had some sort of skin inflammation or skin condition, and due to this single wave precise coherent laser therapy, it will like this. It will help to improve at least in this case this condition. Therefore, laser therapy is quite important nowadays, and it has been used more often, in order to especially in order for pain treatments and cosmetics, but also treatments of cancer as radiotherapy. So to conclude, laser therapy is important nowadays, and it can be used in different situations. However, we need to be careful, because if we abuse of this treatment, it can be harmful for our bodies.